Afternoon, everyone, and good evening. I'd like to continue our discussion today regarding the PCOS or polycystic ovary syndrome. We know that in unoperated women, PCOS, we found there's the follicular development arrested in diameter between 5 to 8 millimeters. And if you look, the median density of healthy and athletic of follicles in cortical biopsy unfollicular tissue, they have the highest number of total follicles compared to the low ovulatory tissue and normal patients. Why it's happened? It is because of the role of AMH. You can see it might be happen because of higher initial population of choroidal follicles representing by the red line or the slow rate of loss by atresia, blue line. This is happens because of the role of AMH. Then we can see MS production in the growth of cells. The MS will be disappear when the follicles diameter more than 10 millimeters. Also, we can see in the immunohistochemical, this one, you can see that the MH was disappear whenever the follicles larger than 10 millimeters in the diameter. So the pathophysiology of PCOS is very interesting. This is the most common endocrine disorder of women, affecting up to 15% of women in this age group. And you can see that the key features has synergistic effect with insulin resistance. Because of insulin resistance, inducing hyperinsulinemia, and then also hyperandrogenism, decreasing the sex hormone binding globulin, so it will increasing the free androgen and free estradiol in the blood. So that's why the follicle was disrupted, rested in the ovary. So I was study trying to see the mechanism of elevated LH FSH ratio in lean PCOS, and then we can see here the kisspeptin actually the main regulator, whether neurokinin B and dynorphin regulate kisspeptin secretion. And then the our study, sorry, yes, this is our hypothesis. Our hypothesis looks at the, sorry, I cannot confirm my slide. Yes, yes. Through our study, proving that the kisspeptin, there's a role of insulin resistant with the leptin and also insulin resistant with decreasing adiponectin. Then the norphins, they will suppress the kisspeptin, and then very important that MH, they have a positive role increasing LH to FSH ratio and also increasing the free androgen index. So that's why in the patient of PCOS, in the PCOS patient with increasing the serum AMH, it will disturb the LH to FSH ratio and also will suppressing the adiponectin and then inducing the insulin resistance. This is our study in Jakarta. So if you look this one, how the high level of AMH is suppress aromatic activities enzymes in the ovary. So it will inhibit conversion androgen to estrone. So increasing androgen, it will disrupt the follicle genesis, the follicle growing. It will increase in the inhibin B, and then the later will suppress the level of FSH. So FSH cannot be on the threshold, so that's why the follicle was arrested. It is the explain why the role of MS is quite important because MS reducing the sensitivity of follicles to aromatic enzyme, and then the YMH is high in previous patient. Our study found there's a mutation of the MS gene promoter in previous patient. There are 60 point mutation in the MS gene promoter. So that's why the level of MS is quite high. You can see here the three mutations with highest percentage in the PCOS patient. The other thing also, our study trying to see many genes actually affected the AMH expression in PCOS. This is in silico studies by using the bioinformatics. At least there are 82 candidate genes associated with PCOS from database. Then we can prove one of them is AMH. There's correlated with insulin resistance. And then AMH also in our study, we can prove they can even be used for diagnostic and prognostic tools in PCOS patients. In our population, AMH patient is 3 times higher in PCOS compared to the normal patients. And then if the level of serum AMH is more than 4.45 nanograms per milliliter, actually there is suspected to have PCOS with sensitivity around 76% and then specificity around 75%. This is our study. And then you can see the probability to have the PCOS if they have a level more than 4.45 is 9 times higher the risk to suffering from PCOS compared to the normal patient. In our population, we can see if in the full-blown phenotype, the level of serum AMH is higher compared to the U androgenic. This is U androgenic, which is the most phenotype PCOS in our country with the lowest level of serum AMH. So that's why the highest serum AMH it is correlated with the highest the severe type of PCOS. Our study also proved that the patients with the CC resistance, this is in unsuccessful, they have significantly higher of serum AMH compared to the patient who success to get ovulated after ovulation induction with CC. And then we can see here at least if the patient have the AMH level more than 8.5, they will suffering from the CC resistance higher. So that's why we use AMH as a cutoff point for predicting CC resistance in PCOS patients. Another study also we did to see how the correlation between AMH with insulin resistance. Again, this one, we can see across all the phenotype. This is the full-blown phenotype, AMH is highest. Then this is U androgenic type phenotype, the AMH is lowest. Then also it's correlated with insulin resistance. So the higher AMH level, the highest also insulin resistance. And if we look this one, this is also fasting insulin. The full-blown phenotype, they have highest fasting insulin compared to the U androgenic phenotype. And if we look the linear regression models, we found association between AMH and insulin resistance with coefficient correlation 0.52. This is significantly statistically significant. And then we also do the study how the effect of the metformin and cinnamon to serum AMH in the women with PCOS. With PCOS, we do the double-blind randomized control trial for 6 months. This was the one group with metformin treatment, the other group with bioactive fraction of cinnamon. Then we are comparing these both of two groups. This is the most likely is normal and overweight. This is also the bottom group has a high level of AMH. We can see here, this one in the metformin group, this is baseline AMH, 9.3, and then the AMH level post-treatment is 7. This is baseline group from cinnamon, 11, they decline until 10 after 6 month treatment of the metformin with the cinnamon. Then the side effect, the cinnamon has a lower side effect compared to the metformin group. And then if we look this one, there are 5 patients spontaneously pregnancy after 6 months treatment of metformin. Then all of the patients have the getting the lower level of AMH after 6 months treatment with metformin. You can see here the changes of AMH after metformin treatment. Also in the cinnamon, there are 2 patients getting pregnant and then both of them declining. There's declining of AMH level after 6 months so the patient can conceive spontaneously. We did also study to see how the correlation AMH level with the metabolic syndrome. We can see on the phenotype 1, I think this is the highest rate of suffering from the metabolic syndrome compared to other phenotype. You can see here the hypertension, diabetes mellitus, and also the highest level of AMH. So the higher level of AMH, they will suffering from metabolic syndrome, the higher risk compared to the PCOS patient with lower serum AMH. You can see here in the phenotype 1, 36%, the patient suffering from metabolic syndrome compared to other phenotype in PCOS. The other study also we are trying to see how the metabolic performance if we compare it, look to the patient PCOS patient after receiving the cinnamon treatment for after 6 months. This is clinical and metabolic efficacy and also the safety. We can see here this one comparing the metformin with the cinnamon after 6 months. Then this is where you can see the ratio, the stromal to ratio compared to area ratio in SA ratio in ovary. There's a declining. This one is the metformin group. This one in the bioactive fraction of cinnamon. BMI also declining. Y circumference also declining after the 6 months of the treatment, and then menstrual regularity also most of them both of the cinnamon and the metformin they are getting better, the regular increasing regularity of the menstruation both of in an ITT or per protocol group. And then the last we can see here the administration of cinnamon. This one is the baseline characteristic, and then lipid profile, and also hormone insulin resistant and free testosterone profile. You can see all the this one is triglyceride is getting better after 3 months, and then also hormone insulin resistance is getting better. The free testosterone also getting better after administration of cinnamon 6 months in PCOS patients. So based on the all the study regarding serum AMH, we can see that this one all the guidelines, all the guidelines of the 20 in PCOS patients. I cannot move the slide. Oh, back. Yes, yeah. So as a take-home messages, we know that is in the inclusion of serum AMH in PCOS, it is because of there's some mutation in AMH gene promoter, and then based on signaling pathway of PCOS prediction, AMH look as promising biomarker that can be used for the diagnosis, grading the disease, and treatment monitoring of PCOS patients. There is indirect relationship between serum AMH and insulin resistance in PCOS patients leading them to suffering from high risk of metabolic syndrome. And then bioactive fraction of cinnamon showing us good evidence as an insulin sensitizer that can improve PCOS and also metabolic